Welcome, everyone. Glad to see you here at the library this afternoon, and welcome to those of you who are watching the program online as well. We have not had a What the Health series program since before the pandemic, so yay, we're back. We're delighted to be able to bring these community education programs back to the library, and upcoming events later this month are on how to give up tobacco and how to stick with that, and another program on learning hands-only CPR. So check the calendar for those and get some more information if you'd like to come to those as well. We are so pleased to have Casey Atwood here today. Casey's a registered dietitian nutritionist from Innovative Nutrition and Wellness. Her focus is on longevity and wellness. Casey's been certified in culinary genomics, which is the art of choosing, preparing, and cooking ingredients in a way that's best recognized by our DNA. She's here today to present this approach to nutrition and help us achieve overall optimal health. So with that, I'm going to turn things over to Casey. Thank you. Yay, come on up.
Hi, everybody. I'm going to be on the podium, so I'd rather be down there with you guys, but I'll be up here so you can hear me a little bit better. I'm Casey Atwood, and like Renee said, I'm a registered dietitian nutritionist, and I have been working in a lot of different areas, and so I wanted to kind of bring in some knowledge to you guys from where I've been. So I have about 15 years of experience being a dietitian, and I have done everything from culinary. I was the food service director of a hospital, so we did a lot of culinary aspects there. We did all the food service. We did a food truck. We had lots of stuff going on with that, and lots of nutrition, all our dietitians in the hospital as well. We were kind of over all of that. I've worked in research, and so I've spent quite a bit of time researching and looking at nutrition and research and things like that. And then have experience in the hospital as a clinical dietitian. So I've been at the bedside with the patient as well. And then in community as well. And I think this community nutrition is really my favorite. I like talking with people. I like giving information. I just love just kind of sharing information. And I love getting information back as well. I love learning. And so I am always open to learning something new, and I talk with people all the time, even in groups like this, where, you know, I always learn something as well. So I love the back and forth communication that we can have. So if you have any questions or comments or suggestions, please let me know. So, all right. Well, tell me a little bit about you guys. So I'd love to hear from y'all today and kind of know what you know about brain health and nutrition and why you guys might have come over today to this talk.
Oh, I'm not shy.
Okay, bring it.
Leo in the audience.
I love it.
I've discovered I had a series of, when you get hit from behind, whiplashes.
Okay.
This is my atlas nerve has been severely compressed, so I'm not getting blood flow to the brain.
Okay.
So
Yeah.
now I'm getting some correction there with some adjustments and stuff. That's one. Like I'm hardly have a brain. And number two, I've discovered I had a genetic blood disorder. I've been low on, so all my life I've been told microcytic anemia, when in fact it's thalassemia. So folate levels were almost nothing. You know? Like, okay, I gotta catch up. I
Yeah.
had some serious catch up to amplify serine, L-serine.
Okay.
Amino acid, I had almost none of.
Oh, wow.
You know? And to get this neck and this atlas nerve. So a physical and a nutritional
Okay.
sort of, deficit there.
So kind of twofold there, twofold things going on. But I think that's how a lot of us are. I think, we have very complex things going on. And, if you're wanting to get really kind of in depth, you could definitely talk with the dietitian and get more in depth on what you would need specifically. I think generally we can talk a lot about kind of general health today. And I think that's what we're really going to talk about, kind of those general guidelines lines, but definitely there's all different ways that we can explore with nutrition in that aspect. So I thank you for bringing that up. So, yeah. I love it. Anybody else have any comments or anything?
Doctor said I should eat 7 almonds a day, and he doesn't know why.
Oh, okay. I love that.
Somebody said that was a good idea. Is what it was.
I hear that all the time, and that's one of the things that I love what I do is that I have had so many patients come to talk to me about, my doctor told me to eat vegetables, and I'm here to talk to you, and so they don't know why they want to do it, but, and then I don't feel like doctors are telling us why we want to do that, but it's my job as a nutritionist to do that. So what about you?
Well, I just feel inspired after his comment because I've recently done a blood test for food sensitivity.
Okay, yeah.
And almonds is something I'm sensitive to.
Okay.
Which according to like generic food recommendations is almond flour, almonds.
Yeah.
All the almonds. And
But
so-
you can't have that, or
Well,
you're
I mean,
sensitive to that, I
yes.
guess, yeah.
Mhm. And
Mhm.
other things that would fit in a classic healthy diet that
Yeah.
I am sensitive to. So it's interesting to me that the DNA parts
Mhm.
of, the more specific per person, which I know you're doing general, but.
Yeah. Well, I think that is kind of the theme here is really, there is this general nutrition, but we are all different, and I think that we can all see that, and I think that that's what's great and makes us individuals, but there is not really all one diet fits all, and I don't think that. So I think that there are some, general recommendations we can make in a community setting, but getting a little bit narrowed down as we learn more about the individual. So, yeah.
What do you think about the food sensitivity testing? Do you find that in your practice something that you feel is beneficial?
I think it can be very helpful, especially if there are some, ongoing issues and you're not sure where they're coming from. I think that it can be very helpful. So I do think that. So, yeah. Yes, ma'am.
I've been listening to podcasts about brain health.
Okay.
I listened to 3 different podcasts. I had 3 different opinions. One should be, you should be a carnivore almost entirely. One, you should eat olive oil and carbs twice a day,
Mhm.
and very little meat. And the other one was advocating the Mediterranean diet. So
Yeah.
I'm most interested in finding out about how to promote a healthy brain.
Yeah. So that's what we're going to talk about today, kind of where the research stands on those things, and we'll kind of look at a few things. So we'll go ahead and get started with our presentation. Hopefully we can get through. So we're going to discuss the 6 fundamental pillars of brain health. So there's a lot more that go into brain health than just your nutrition. So we're going to talk about all of those things that are going to stack up and kind of be a part of that system, our overall system. And I made a little handout. I think she's making some more copies if you did not get that, but it kind of talks about the 6 fundamental pillars of brain health. We're going to talk about some lifestyle strategies supporting that. We're going to talk about some key nutrients that we can look at in the research that we do see that is supporting our brain health. We hope to name some foods that we can kind of narrow down a little bit, and then we're going to use a little bit of foods. I would love to be up here cooking for you guys today, but they wouldn't let me do that today, maybe next time. But I do have a little video I'm going to show, just one quick little recipe, but then I also have, if you do the sign-up sheet over there, I have a recipe pack with about 9 recipes that I can send to you over the email, at least so you have a little bit of something to start with. So, let me go the right way on here. So, okay. So just an introduction of the brain. So the brain is our control center. Everything happens in the brain. If something happens with our brain, there's so many things that don't happen. So, and it controls everything. So our memory, our sleep, thirst, hunger, everything starts in the brain. And so it's just really so important to be able to maintain our brain health, especially as we age. And it's just so interesting how many chemical and electric signals that are sent by the brain to all different parts of the body. And so right now we're looking at the research between the gut and the brain, the lungs and the brain. So we know that, our gut health, and maybe they'll let me come back and do a gut health nutrition next time, but the gut health is connected to that brain health as well. And so we see these, when we're looking at the research, we see these neurotransmitters that are created in the gut that travel to the brain. And it's just really fascinating how it's just really all connected there. So that diet is definitely connected to that brain health. So neurodegenerative disease such as Alzheimer's and Parkinson's disease, they really result in this decline in the function and number of nerve cells in the nervous system. So that's really what we're looking at. And those risk factors include age, genetics, and environmental factors as well. So there's a lot of things that are happening here. It's not just one factor that's contributing to neurodegenerative disease. There's a lot of different factors that we're looking at here. So the 6 pillars of brain health, we're going to be looking, just kind of briefly talking about exercise, stress reduction. Sleep is so important. Really, probably one of the best, most important things we can do right now for ourselves is to get some good sleep if we can, and support that good sleep and make that a priority. Socialization, so being here together today is a piece of that. So just going to a class, talking with people, being a part of your community, so important for us as humans and moving forward. Supplements and medications, taking your medications as prescribed by your MDs, and then those supplements that might be prescribed. If you're low in vitamin D, your doctor might prescribe you some vitamin D supplements. So thinking about those things. And then we're really going to be talking about this food and nutrition as well. So exercise for brain health. So we know that 80% of diseases are preventable. So when they do the research on that, there was a study I think it was in 2010, the World Health Organization determined most cancers, not all of them, but most cancers, diabetes, heart disease, are mostly preventable. And exercise is a huge piece of that. And it doesn't necessarily have to be a marathon. You don't have to be running every day. You can be gardening. You can be walking. You can be, doing some things around your house that can be considered, exercise. Just basic movement. Like I said, it doesn't have to be, running. When they, one of my favorite things to kind of look at is looking at those longevity studies, looking at the blue zones, if anybody's familiar with the blue zones, and looking at those zones around the world that have a really high incident of centenarians, which is those that are over 100 years old. They look at a lot of factors in those studies, and one of the factors that they look at is their amount of activity. And so, those that are over 100 years old, a lot of them are not, they're not marathon runners. They're just basically moving. They're gardening. When you're looking at Sardinia and Greece, when you're looking at Okinawa, things like that. There's California, Loma Linda, California. Thank you. Our person from California, of course, knows where that is. And so those places around the world, like I said, they are really one of those factors is that they are moving. And it is not necessarily that they're, marathon running. So it can be yoga, at-home resistance bands. There's just so many things that can be included in that. And then we could go on and on about the health benefits of exercise, how it helps us sleep, our physical health, that mental health, immune function. So many things are tied to that. So We've got several different kinds of exercise. You have that aerobic exercise that helps promote that brain cells regeneration and helps preserve existing brain cells. So that would be running, but it just kind of getting your heart rate up and things like that. It's really good for us. But walking could be included in that, at a fast pace. Yoga could be included in that as well. Those strength training, and I love this, kind of improves our concentration and decision making. So that's really an important part of it too. I think that's something we don't really think about as exercise, is just getting a resistance band and using one of the bands at home, just while you're sitting there watching a movie or something like that. You can still be working on that, helping that brain health right there when you're doing those exercises. So stress. We all have a little bit of stress. Anybody have some stress? Nobody? Stress-free? Yeah, so there's a few different types two different types of stress. We have this acute stress, that fight or flight. So if we see a bear, obviously we're going to get pretty stressed and we're going to want to flee. So that fight or flight response, we have that threat. We have the increased heart rate, we have rapid breathing, and then the threat subsides and all that goes back to normal. And then we have chronic stress, which a lot of us, this is really what we all are feeling all the time. I feel like I can't ever get away from the stress of life. And there's some real things that are happening here with this chronic stress. And how do we deal with that? That's really kind of hard. How we deal with it. We can't turn off, certain things. We just have to figure out how to deal with that stress a little bit better. Stress is never going to stop. Nobody's going to stop calling you and ask you for money for your bills, or, that's not going to happen. And so we just have to figure out how to better just deal with that stress, I guess. So some stress management strategies are just practicing saying no. Seeking professional help, getting adequate sleep is really important. Exercise is really important for managing that stress. So I think these are all things we kind of know, but I think these are just really good reminders. I need to be reminded of these things often of, okay, Casey, go outside, take a walk, get your stress level down a little bit. So sleep. So who gets good sleep in here? Good, that's good. Recently, I've put sleep as one of my number one priorities, as I had a really, really stressful job, and I would wake up in the middle of the night, and I would think about my job, and it was pretty awful, and I didn't get very good sleep. And so I decided to kind of make sleep a really big priority for me, and it has made such a difference in how I feel, how I manage my stress, and it's really, really important. And we're going to talk a little bit more about sleep here in just a little bit. But one of my strategies for sleep is to treat myself like a baby. Before I go to bed, I am like putting on some comfy clothes, maybe taking a bath, putting on some candles, drinking some tea, like just really treating myself nicely before I go to bed, getting myself ready, just really spending some time, because it is really, really important. And so I'm going to set a bedtime routine, set a time, maybe shut off some screen time before you go to bed, regular schedule, even on the weekends. So weekend times, you might have a different schedule. And so even keeping up on your schedule on the weekends, if you're retired, keeping a schedule there, I think that's really kind of hard. I have some clients right now that are retired, and it's been very difficult for them to keep up with a regular schedule. And so their sleep schedule is all over the place right now. So just making sure you're getting that regular sleep schedule. But again, treating yourself like a baby, just treating yourself nicely, and that can help with that process. So we need about 7 to 10 hours of sleep a night. So the studies have shown that is really important. So. And then we talked about that socialization. So just, again, being here today, talking with everyone, talking with your friends, calling somebody up on the phone, taking a class. It can really help feel connected, enhance your mood. And there's a lot of things that happen to humans, especially when we socialize. And so that's really important. Another factor in the Blue Zone studies was the participants in the studies, their socialization. So that was really important, and that was something across all of the communities that they studied and looked at, was that they had a really strong sense of community, a really strong socialization with each other. So that is a really important part of who we are. And just a couple strategies there: volunteering, networking, neighborhood events. There's endless. So there's lots of ways to communicate and to socialize with your neighbors and your friends and your family there. So medications and supplements. So just making sure you're talking with your doctor about, your medications, or your pharmacist about your medications. Is there medications that are causing you, lack of sleep or keeping you up? Should you take them at different times? So a lot of times your pharmacist could be a great person to start with there on your medication. So if you're having some issues, taking your med list to your pharmacist and just asking them. They're the expert on, medications and timing. Of course, docs are prescribing those medications, and they're the experts there, but the pharmacist really can answer a lot of questions, especially on how it might affect you and interactions with other medications, interactions with supplements and things like that. So just making sure you're taking those as prescribed, and kind of thinking about that med list a little bit. So we're going to talk about this brain health and nutrition piece of it. So this is where my piece comes in. Those are all good recommendations, but for brain health and nutrition, the way we eat really does matter. It really, really does matter. What we eat, what we put into our bodies really makes a big difference. So I think it is the World Health Organization, and I can't remember it. The Harvard School of Public Health actually recently has come up with the combination of the Mediterranean diet, which we were just talking about, and then the DASH diet, and it's called the MIND diet. And so there's a lot of research that is supporting this MIND diet here, and it is like I said, a combination of that Mediterranean style of eating and the DASH diet. And the DASH diet is just the dietary interventions for hypertension, and they really focus in on a lot of lower sodium spices, lower sodium foods, and so sodium is a big piece of that DASH diet, as well as plant-based foods and things like that. So in the Mediterranean diet, we're really focusing on those plant-based foods at every meal. It doesn't have to be completely plant-based, but those plant-based foods can be very beneficial for us. And the reason why is that those plant-based foods, they have a lot of information that our body needs. So all of those foods, the broccoli, the cauliflower, the bell peppers, the tomatoes, and you might have sensitivity to those things, and that's something we can talk about at a later time, but generally those kind of foods have so much information that our bodies really need. So there's all kinds of biochemical processes that are happening in our bodies all the time that need vitamin C, that need magnesium, that need potassium, that need B vitamins. We need those things, and those plant-based foods can provide a lot of that information for us. And so that's really where it comes in to where that DNA and those foods that speak to our DNA, it's those plant foods, those herbs, those spices, those vegetables, those are really speaking to our body and our processes. So we need that information. So fish and seafood, let me go back, switch it back a little bit. So fish and seafood 2 times per week. And so that's just an important part because of those omega-3s. We're trying to get some of those omega-3s. They're very, very beneficial for anti-inflammatory processes. They're really beneficial for our brain health. And so that fish is going to be a really important piece of that. Just making sure we're getting good quality fish, that's really important. But that salmon, sardines, tuna, things like that are going to be great things to add in, great source of protein. But really important is a really good source of those omega-3s. And then they have the poultry and eggs and some dairy in moderation. And then, of course, meat, which would be that red meat, that saturated meats would be less often. Not to say that you cannot have those, it's just kind of minimizing those, focusing more on the plant-based proteins, focusing on those fish and seafood and the other foods there. So the DASH diet is really focusing on the sodium-free spices, really similar to the Mediterranean, except really focusing on those lower sodium foods. So the recommendation for sodium in our daily intake is about 1,500 milligrams per day. I don't know if anybody knows how much sodium you're currently getting in your eating plan. Does anybody track their sodium? Well, when I was working in research, I worked in a nutrition study, and we tracked food records. And so I was the lucky one who looked up hundreds and hundreds of food records and nutrition information on those food records. So I pulled hundreds of labels and hundreds of restaurant foods. A lot of the restaurant foods are now available online. And I was just like floored by how much sodium we are currently getting in our standard American diet. So I just encourage you all to go home today and maybe look at the sodium that's in some of the products you might be looking at, and kind of think about that recommendation from the American Heart Association is about 1,500 milligrams. And the standard American diet, you're probably getting about 3,500 to 5,000 milligrams per day. And so that is going to increase our pressure, increase our blood pressure, increase our cardiovascular disease, and can be very detrimental to us. And just a little side note on the sodium, some of us are more sensitive to sodium than others. And so that is genetic, but it's hard to tell. I can't sit here and tell. You probably are not going to know unless you do know, and you know that if you eat something very salty, your blood pressure goes up, and if you don't, if it doesn't, then you're probably not as sensitive. But we do know we can do, those are kind of expensive tests to do, but we can do some genetic tests on whether or not you're sensitive to salt or not. But most of us probably get way more than we need, so. Okay, so just talking about the omega-3s, really important. You can get omega-3s from your fatty fish. You can get it from walnuts, flaxseed, chia seeds, hemp seeds. So there's the two different types of your omegas here. So we have our longer chain omegas that are the fatty fish. Some of us are better at converting the shorter chain, which is the walnuts and flaxseed and hemp seeds. Some of us are better at converting those than others. And again, that's just kind of that's a genetic thing there. So that fatty fish is going to be really important, especially for those that cannot convert as easily. So that's just, all those foods can be included in your eating plan and do provide a good source of your omega-3s. Plant foods. So the recommendations for the serving size are going to be 6 servings of greens per week and 2 servings of berries per week. Berries and greens have so many phytochemicals, like we talked about a little bit ago, all the information that's in these foods. So they are providing so much information for our biochemical processes. So when we look at the studies on berries, they have such a high anti-inflammatory effect that even if you are eating a fairly high inflammatory diet, they still have benefits on there. So if you're eating a cup of berries on top of your inflammatory style eating plan, you're still going to have some benefits because berries are so powerful. So the research on the berry is pretty extensive and good for the Berry Council. They have probably paid a lot of money for that research, but it's very good research. And we know that, blueberries, blackberries, raspberries, I get my berries frozen because they're cheaper, they last longer, and just eating a couple of berries and, you're good to go. So, and your greens are also going to be important. Of course, lots of different types of greens. Yes?
Are you saying the serving is a cup?
Yes. Yeah. I love this one right here. Chocolate, spices. Chocolate is good for us, is what this is saying to me. We've got the antioxidants and the flavonoids in the chocolate, and so I love when we get the good research on the flavonoids and the chocolate there. We have magnesium in the chocolate. It's good for our all of our body and our inflammation and things like that. So even the cinnamon and ginger and things like that are all really beneficial. But I just love hearing about the good benefits of chocolate and coffee, because I like to drink coffee, and I don't want to stop drinking coffee. So always when I hear something about coffee, I'm like, yes, okay, good, I can still drink it. So do what? Yes, it is dark chocolate. Yes, back here, I'm sorry, it did say the chocolate is dark chocolate there. Yeah.
And the coffee is freshly ground, has way more antioxidants.
Yes, yeah, that is very true. And then again, back to our genetics, some people process coffee metabolize coffee differently than others. So if you find your heart rate raises when drinking coffee, then you might be a slow caffeine metabolizer. And so you would just kind of know, okay, I don't need to have coffee, or I need to cut back a little bit. And so you can probably tell a little bit, but some of us are just a little, process things a little bit differently. Yeah, right. That's right. Even the green tea and the black tea and things like that are also have so many antioxidants and good health benefits for us. So red wine here, although when we look at the research, it seems to be quite a bit of the resveratrol is needed, but they still are standing by the glass of wine and red wine. So I'll stand by that as well. So with whole grains. So there's a lot of different eating plans out there. I think I hear a lot of, grain-free and carb-free eating plans, and those, I think that there could be a place for some of those things sometimes, but as a general recommendation, grains are very important for us. They have fiber, they have B vitamins. Those B vitamins are so important for maintaining those neurons. They act as antioxidants. They reduce those harmful effects of free radicals, repair DNA, just so many benefits of those B vitamins. And so if we're not getting those whole grains, we're missing out on that. And that can be your whole wheat, it can be quinoa, it can be barley, it can be any of those whole grains can be really beneficial for us. So, so that is just something that is just great to include. Oh, went back a little bit. And so vitamin D. So looking at the vitamin D sources, salmon, tuna, egg yolks, things like that. If you know that you are deficient in vitamin D, supplements can be beneficial, but that'd be something to talk with your doctor about. So saturated fats. I'm not saying that red meat is totally off the table, but we know that those saturated fats, an increased risk for Alzheimer's disease, and reducing that to less than 4 servings per week is beneficial. And I do like, I'll eat some grass-fed beef. And so we know that because of how that cow is eating the grass and how that is it is producing more of those omega-3 fatty acids, that the grass-fed beef is a better choice for us as far as that red beef, although it's very expensive, and so that's really kind of a hard choice to make sometimes. But I know that there's been some good benefits on that, or some good research on that as well. So. Okay, so we're going to do a little culinary lesson here. So I can't cook for you guys today, but we're going to watch me cook in my kitchen here. So I have included one recipe today for you guys, and it is a shaved Brussels sprout salad. And not everybody likes Brussels sprouts, but I did want to kind of focus in on the cruciferous vegetable family. So the cruciferous vegetable family has a really, really important role in our nutrition. It has the ability to create a really important bioactive called sulforaphane. And sulforaphane, when they've done the research on that, is again so important in so many different processes in our body, from our detoxification system to our antioxidant system. And our bodies are pretty powerful, amazing things. And we have some pretty complex processes that happen. Our detoxification process is one of those things. So our liver does a wonderful job at detoxification, but we can really benefit from these foods that can help with that process. And so those cruciferous vegetables can help us do that. And it can help by creating this bioactive sulforaphane, and that is the Brussels sprouts, that's the cabbage, that'd be the kale, that'd be the cauliflower. So they can produce that, but it's only when you chew it. So if it's eaten raw, or if you cut it and let it set for about 40 to 60 minutes. So before you cook your broccoli, you're gonna cut it up a few minutes, 40 minutes before. So that'd be the first thing you do if you're gonna steam it. Then you'll cook it. It'll produce that sulforaphane in the broccoli, and it won't be as diminished by the heat from cooking it as much. And so we want that production to be as much as it can. So up until 60 minutes, it's producing that sulforaphane. At 60 minutes, it kind of levels out a little bit, or it does level out, and it's not creating any more there. So again, you would just cut your cauliflower, cut your broccoli about 40 to 60 minutes before you're going to cook it, and just make sure you're not cooking at too high of a heat. Or you can be eating those things raw. So you can eat your cruciferous vegetables raw if you wanted to, and that's what we're going to do today with this Brussels sprout salad. So, and again, this is not the absolute best quality. This is in my kitchen, but
This recipe I'm
hope
going
you
to
guys
show you
enjoy
today,
it.
we're going to look at how we can add in cruciferous vegetables into
Can you guys
our
hear that?
diet.
No.
So we're going to be adding in Brussels sprouts, broccoli,
Let's see if we can get them to turn it up a little bit.
kale. In this recipe I'm going to show you today, we're going to look at how we can add in cruciferous vegetables into our diet. So we're going to be adding in Brussels sprouts, broccoli, kale, anything kind of in that cruciferous vegetable family. And the reason why is that these types of vegetables from this family, they can produce a very powerful bioactive called sulforaphane. And this sulforaphane has been evidence-based research has shown that the sulforaphane can reduce inflammation, can increase your antioxidants, can help with aging and cardiovascular disease. And it turns on the pathway for a really powerful anti-inflammatory pathway that we have in our bodies called the NRF2 pathway. And so we want to add in more of these vegetables. So that's part of what we're going to be doing is, just kind of looking at ways that we can just better take care of ourselves. So if we can try to get at least one serving of a cruciferous vegetable in per day, or maybe a few per week, then that is just that one step further, just taking better love and care of ourselves. So we'll go ahead and get started with the recipe today. So we're doing a shaved Brussels sprout salad. What I'm going to do is I'm just going to chop up these Brussels sprouts. So I'm going to take the end off the Brussels sprout and take off the pieces that are a little bit brown, so the little tiny little cabbages. And what I can do with this Brussels sprout is I could really just chop it up really finely with my knife. Or I could use something like, I have this little mandolin. It's not really a mandolin, but it's kind of a mandolin that hopefully won't cut yourself. So I have this little mandolin I could use. So I can chop it up like that, or I'm probably gonna do the rest of it with the knife just to kind of show you guys how easy that is. We have just a little bit of the leaves left over. We can cut those up. So we want just like a really fine shredded Brussels sprout. So I'm gonna have this Brussels sprout salad. It's gonna be raw, and I'm gonna tell you why we wanna have it raw here in just a few minutes. So I'm just gonna cut up a few of these Brussels sprouts in here, and then we'll go ahead and add in our other ingredients. So we're gonna have some olive oil in there today. We're gonna have a little bit of our lime juice lemon juice in there today. Got some shaved Brussels sprouts here. So with any of the cruciferous vegetables, we want to try to activate that sulforaphane in these vegetables. So how we do that is it's activated by chewing or cutting. And so we're going to be chewing this eventually, but we're going to activate it by cutting it and letting it sit for a little while. And so just think about that when you are cooking up your broccoli or maybe your kale. Before you cook it, you want to try, and not to say that that still doesn't have health benefits if you're not able to cut it up before you chop it, but if you're able to give it at least about 30-40 minutes to let that sulforaphane really develop in these vegetables, we're going to get the most powerful of that bioactive released in these vegetables. So with that, we will have this cold salad probably a little bit later today. So we want to let it sit anyway for a little while. And I have them shaved in my salad here, ready to go. I'm going to add 1/4 of a cup of olive oil. So I'm going to add just a little bit of olive oil to our dish here. And we know that olive oil is one of those really beneficial anti-inflammatory fats. So we definitely want to include that in our dish. We also are going to add a little bit of lemon juice. So I'm just going to cut up about 1/2 lemon. I'm going to do 1/2 lemon in there. And so we're going to do about 1/4 of a cup of lemon juice. We're going to add a little bit of dried unsweetened cranberries to the mix. We're going to either use a pine nut or a walnut. I'm going to use some macadamia nuts today, and I'm going to chop these. I'm just going to add these to the salad, give it a nice little crunch, and then we're also getting those healthy benefits from the nuts as well. So I just want to chop up these nuts, whether it's the pine nuts, whether it's the macadamia nut. These are some raw macadamia nuts I'm using, and the raw pine nuts, you can toast them if you like that kind of toasted. I am going to go ahead and just add them in raw today, but you can add a little bit of toastedness to them if you like that. You can also use a little food processor. I use my NutriBullet a lot to do a quick little pulse to make the nuts a little bit more manageable, because these are going to be big chunks here. If I can get it down a little smaller. Okay, we're going to throw in our macadamia nuts in there. It's going to be so delicious. We're also going to add just a little bit of Parmesan cheese. You can add whatever kind of hard cheese that you like, but we're going to just shave a little bit, probably about 1/4 of a cup of Parmesan in here. Going to add just a little sprinkle, a little pinch of our salt, and a little bit of pepper here. And we have our shaved Brussels sprout salad. So we want to let this sit in the refrigerator for at least 40 minutes, because we're trying to let that sulforaphane really get started to produce in here. But this will be great chilled all together. This will be great side for dinner tonight. So hopefully you guys enjoyed, and I will go ahead and add a little bit of some fresh chives. I forgot I pulled these out of my garden this morning. So I'm going to go ahead and throw in a little bit of fresh chives here. Just right on top of it. Throw in the chives there. Our beautiful shaved Brussels sprout salad for your enjoyment. So
That was not the best editing, but I'm learning to do better there. So So yeah, here's the recipe here, and I do have a couple recipes for you guys if you would like to sign up for on the sign up sheet back there. I can send you those in their electronic copy. And so there's a salmon recipe in there. There's the Brussels sprouts. There's also a chia pudding in there. So we talked about those chia seeds being really important for that, omega-3s and the flax seeds and things like that. So there's a recipe for that in there as well. And so you guys can have that, but it is an electronic form. So, yes, ma'am.
I was wondering, like, when you see the lettuce and cabbage and stuff all cut up in a package.
Uh-huh.
Is that, does it lose a lot of its nutrition?
It does. Well, they sit in there for quite a while, and so once something sits on the shelf for a while, it will lose a lot of its. It will deplete. And so, but they do spend a lot of time, food researchers spend a lot of time on packaging and a lot of money on how to get it packed where it will stay fresh. And so I don't really know for sure how much is depleted in there. I would expect some of it to be depleted, but so.
Or like how old can, like if you buy broccoli and wait 5 days
Yeah.
to cook it, is that a bad thing? Or?
Well, yeah, and I think when they do that research, it's definitely you're going to get more higher nutrients from if you just picked it, for yourself. But if it sits on the shelf in the grocery store and then sits on your shelf for a couple of days, then every day you're getting a little bit. But I don't have the numbers on that. But yeah, definitely, yeah. Mm-hmm. So just to kind of review, we have talked about a few of the nutrients that are really play a role in that brain health and then overall health as well, but really connected to that brain health. We can name a few foods that support that, and then hopefully we've been able to have some stress management techniques and some lifestyle strategies to help with helping your brain health. So we're going to do a little bit of goal setting here today. And so you can write down a few things if you want to, or just keep it in your mind if you'd like to, and your strong brains there. But when we look at goals and goal setting, we're looking at making SMART goals. Those are specific, measurable, attainable, relevant. There's a time frame around them. So I'm just going to have a couple examples of what that could look like for you guys. And so one of the examples of a goal, I will add in more exercise to help me achieve my goal of focusing on my brain health. I'm going to add in 30 minutes of exercise 5 times a week, Monday through Friday. So you see how specific that is. You're not just saying, oh, I'm going to exercise, someday. Having some really specific intentions is really important for that goal setting. Another example would be I'm going to set a goal of reading 12 new books this year to keep my brain healthy and learning something new. So when we look again at those brain studies and things like that, we know that learning new things can help with our brain health as well. And so so that could be, one of your goals. It doesn't have to be nutrition related. And then another goal could be I'm going to add in a serving of cruciferous vegetables into my eating plan 3 times a week. And so I'm going to try Casey's shaved Brussels sprout salad this week. Here's a couple of book recommendations since we're at the library. And something I read recently, I don't know if anybody has read Still Alice by Elisa Genova. She's a neuroscientist. Her book, Remembering and the Science of Memory and the Art of Forgetting, is amazing. I thought it was a really good read and had some really good recommendations on that learning something new. It was really a great read. There's the book, The Mind Diet, and it's written by Maggie Moon. She's a registered dietitian. If you're wanting some more in-depth information about that mind diet and what's included in that. And then one of my favorite by my mentor in the nutrition world, The Genomic Kitchen. Amanda Archibald is a registered dietitian, and her book, The Genomic Kitchen, really looks at, and she's, like I said, my mentor, my guru on the genomics in the kitchen and the culinary genomics and how to put all of that together. And so she's got an excellent read there. So just a couple of book recommendations for you guys. And then I did want to plug Lisa Genova one more time. She has this really great TED Talk on YouTube. So if anybody's interested in what you can do to prevent Alzheimer's, she has a really great TED Talk on it. So like I said, I'm really enjoying reading her book and learning a little bit more about her. So this is how we can connect if you're interested in connecting with me. I will send you that if you want me to. I will send you that recipe pack if you're interested in those recipes. So thank you so much. I appreciate you guys' time. Anyone have any questions or suggestions or comments today? Yeah.
When you're cutting up your cruciferous vegetables and getting that slurping, so we usually leave the cut up lettuce in the salad spinner in the fridge. It stays crisp really well.
Yeah.
Does the sulforaphane hang out pretty well?
Yeah, it will. Yeah, it will. I mean, for not an extended amount of time, but I think it will for a couple of days for sure. Yeah. Yeah, that's a good idea. Just already having it cut up and just ready to just pull some. Yeah.
It stays really crisp and easy to do.
Yeah. Do you keep it in a little container or?
In the salad spinner.
Yeah.
So that
Oh, yeah.
if it continues to drip, it goes underneath and then to the bottom, and then
Yeah.
you still have water collecting there, but the salad stays nice and hot.
Yeah, that's good. Good idea.
Also, anything like cilantro, put it in a mason jar with water and cover it with like the plastic bags that you bought it in.
Oh, yeah.
Stays
Stays really fresh that way. Okay. Yeah, great. Herbs, we didn't really talk about herbs, but parsley, cilantro, all of those things are excellent to add in. All have really important bioactives that help in our detoxification system and our anti-inflammatory systems and things like that. So adding those fresh herbs can be really important for that brain health and then overall health. So, yes, ma'am.
In a previous life, I worked with farmers and food people in states
Okay.
around the country, and mostly organic and sustainable farmers. So all food is not created equal.
Yeah.
I mean, at this point, many soil scientists say we only have 60 years of soil left right now.
Wow.
Soil that will sustain life, that will grow food, that will sustain life. So right now, the big push is regenerating soils that have been just used up.
Depleted and
wasted
yeah.
depleted.
Uh-huh.
So nutrient-dense foods is a specialty kind of thing.
Yeah.
And a tomato of today is nowhere near the tomato from 100 years ago.
That is so
Not even
true. I don't think any of our food tastes the same way that it did. Yeah.
how that food is grown matters.
Yeah.
And even though you talk about price, it may be price, but we got to think about what the cost
Yeah.
of that is, the cost to our bodies now. Excuse me, that's my son.
No, I agree. I agree. Yeah. Well, thank you guys. Thank you very much.